year ago, the two Economic Development Administration designated university centers in Arkansas, the Arkansas State University Delta Center for Economic Development and the Arkansas Economic Development Institute, partnered to create a blueprint for Arkansas's recovery and resiliency. This partnership has multiplied our resources, our ability, and our capacity to help with recovery and resiliency strategies across the state.
We decided to take on the task of developing our own dashboard, and we decided that we would approach it from a unique perspective, a perspective that emphasized the various fields of expertise at AEDI in economics, demographics, community development, and GIS. The approach that we took was to look at the various socio-economic impacts that COVID-19 was having on the state of Arkansas and the surrounding region.
I just feel like we've got this huge data mine, a gold mine of data, if you will, that's available, that y'all have done a tremendous amount of work on getting put together.
What are all these clinics doing around this, and what are the presence of clinics in the state? And if we want to get ahead of the next pandemic, what would it look like to start paying attention to that blip on the radar with those clinics? So this is an interesting perspective in terms of things that came up during the COVID pandemic.
But we even talked about and are working on starting our own staffing agency, specifically with nursing, where we would, you either work for a hospital or you work for our staffing agency, where we cut out that middleman and that cost. So, we're starting to think drastic measures here.
This is visitation to rural hospitals over 2020 compared to 2018. And we can see in April, the dip from shutting down outpatient procedures, and then as outpatient procedures are allowed to continue, there's a slight increase and then kind of a decrease. But what's interesting and what we think is an important piece for puzzles for businesses and for the economies of these regions is where these people come from.
The EDA, in providing this grant to us, is giving the two university centers that serve Arkansas and the 8 planning and economic development districts a very unique opportunity to historically document the impact that COVID has had on all 75 counties in the state.
The blueprint for Arkansas's recovery and resiliency encompasses 3 major items. 1, it documents the historical impact of COVID-19 on the state of Arkansas. 2, it provides training for both the public and private sectors in our communities. And 3, it creates regional strategies for building resiliency for future pandemics or economic disruptions.
You can look at where are the blips around us before people end up in a hospital that we can get ahead of a pandemic, and how can we pay attention to pharmacies, clinics that are giving us a sign that something is happening before people need really significant care in a hospital.
The Arkansas Recovery and Resiliency Plan will undoubtedly amplify disparities found between the rural and urban areas of our state. But a systematic and information-based approach to determining when, where, and how the virus impacted both urban and rural areas will help our state, regions, and local economies make efficient use of all the recovery resources and create more effective resiliency plans.